All right, let's move on to Omicron. Wanted to try and just, highlight the pieces of good news that I don't think are being really propagated by the media. So Miami Hospital, to be clear, just hospital data, COVID data, all of this has been so frustrating to deal with, Krystal. In terms of parsing positivity rates, obviously we have a test bias. If you test more, then you're obviously going to see which tests hit, when. Hospitalization, the same thing. We have a policy generally, almost every single hospital, a patient enters, they get swabbed for COVID, so are they because of something else with COVID or not? Now, a new hospital in the city of Miami is actually releasing some of their COVID data, but they're breaking it down from people with COVID and then also those who are because of COVID. So let's put this up there on the screen. Now, 50% of recent COVID quote-unquote hospitalizations in this Miami area hospital network are actually people with COVID. Now, of the 22% of all COVID hospitalizations, incidental and non-incidental, so that means with and because of COVID, they are vaccinated. Are vaccinated. 48% of vaccinated COVID patients themselves are immunocompromised transplant patients. So it just goes to show you that of the people who are vaccinated because of COVID, obviously, vaccination dramatically reduces your likelihood of being in the hospital in the first place. And then even those who are there, who are vaccinated, those people are severely immunocompromised transplant patients. I don't want to minimize their experience. It's terrible. But those types of people are disproportionately always likely to end up in the hospital with the flu, a cold. I mean, when you're on those immunocompromising drugs or whatever and are trying to accept some organs, I mean, it's a bad state. Same with chemo patients and more, They always say people who are deep in chemo, you're like, hey, you got to keep these people away from, a flu can kill you whenever you're in that level of an immunocompromised state. I am not whitewashing their experience. I feel terrible for them. I'm just giving you an example of when we're trying to craft public health and we're trying to have an honest conversation around the hospitalizations and who are the people who are actually in the hospital. This is some of the clearest data that we have yet. New York City is said to be following in due course. They're going to be breaking apart this data. I do have to say, I think it's taken, I don't know why it took 2 years in order for this to be the case.
To get
but
this kind of
look,
information.
it's very good in order to see this. I think we should celebrate. Vaccines work. They work incredibly well at reducing the risk of hospitalization and death. During the Robert Malone segment, we have another chart actually in order to show you in terms of vaccination status versus unvaccination status in hospitalization. We are talking about almost a tenfold in terms of the difference across all different age groups.
It's
That's
really
very,
consistent. That was the part that was really striking in those particular graphs that Derek Thompson tweeted out, is it's really consistent. No matter what age range you are 10 times more likely to be hospitalized with COVID if you are unvaccinated. I mean, that's really the thing for people to understand. I think it is also important to say, the fact that you do have a significant amount of the population that has things like, that cause them to be immunocompromised, that is also part of the case for why it is a public responsibility to get vaccinated to help to try to stop the spread. Because there are people who, the vaccine is going to be less effective for, and even if they get it and even if they get boosted, it's just not going to work as well, and COVID is going to continue to be extraordinarily dangerous for them. But the bottom line here is really simple. It's what we've been saying all along, especially with Omicron being a less severe disease. If you're vaccinated, you're very, very likely to be fine. Especially if you're young, especially if you're healthy, then your risk with Omicron is, extraordinarily low.
It's minuscule.
And so, we need to make sure that public policy, especially given the fact that at this point, everybody has had universal access to vaccines for quite a while now. So public policy should reflect that landscape that exists today.
Same thing on the Omicron wave, so to speak, regionally, at least here on the East Coast. Things in real time actually seem to be okay. So let's put this up there on the screen. So the decline in Google searches for COVID symptoms in the New York metro area over the last week has actually had a pretty significant drop-off. And while the test positivity rate continues to be reported, something you guys should all remember is that test results during the Omicron shortage were taking up to like a week or more in order to be reported. So it's actually very possible that it's older results that are being positive and they're being reported in terms of positivity. And also what we're seeing too is that a vast majority of rapid tests and more cases don't ever get reported. Actually, now that I think about it, I never reported my case, because I got a rapid test, why should I? And so that is something which, again, it's difficult in order to try and get a hold of that. The reason that we look at Google real-time search data is if you look, and this is connecting some of our lab leak stuff, if you go and you look at, not Google, I think it's Baidu searches for like diarrhea and cough in Wuhan, it skyrocketed in like the month of October. In the month of October, it's one of the things that was put together by those Harvard University researchers in terms of open source data where you can pinpoint the exact timeline of the virus when, it may have escaped from the lab and then spread through the Wuhan population. I just am pointing to these types of metrics you may not hear from others. They just painting a very different picture. But sadly, and this is one which, I just think is awful, is that Omicron is just really, really closing a lot of public schools across the country right now. Let's put that up there from the New York Times, which is that schools nationwide confronting the chaos of Omicron. Here in the DMV area, you have a lot of schools that have gone ahead and gone virtual. Even worse, though, is all of these universities. I mean, universities with literal booster mandates going virtual for what they say is the month of January, but everybody knows is going to continue. And, they're even saying that they won't be coming back in some of these cases. I hear from many of these students, and they're like, well, they say until the peak of Omicron is over. Well, what does that mean? I mean, once again, who decides what the peak is? How long is it to take? Is it 2 weeks after? Is it 3 weeks after what the peak is? Nobody knows. It's just up to these like COVID bureaucrats who are in these places. But
who are clearly just making it up as they go along.
Oh, God, 100%. And even then, somebody sent me yesterday, like the head of COVID, whatever policy at Georgetown University was like out at a concert with the mask on. But fine, looks, I don't care. Go attend your concert, attend your show. But you're literally locking down students in their dorms and telling them to like hold meetings outside in the frigid cold while you're not abiding by the same thing. One interesting note, though, of the blue state, officials, new Mayor Eric Adams sitting down yesterday and declaring emphatically those schools are not going to close despite Omicron. Let's take a listen to what he said.
The safest place for our children is in a school building. And we are going to keep our schools open and ensure that our children are safe in a safe environment. Our children were exposed to an environment of crime, of uncertainty. It really traumatized parents that did not have child care. The remote learning aspect of it was terrible for poorer communities, particularly those children that lived in homeless shelters or that were housing insecure. The food aspect, schools provide primary meals for many students in this city. And then the socialization. We saw an increase in attempted suicides. We're not sending an unclear message of what is going to happen day to day. I'm going to tell you what's going to happen day to day. We are staying open.
Very interesting. I mean, one of the only officials really is just coming out and declaring it forcefully. I think personally, very much on the right side of public opinion and of New York City parents, Krystal.
And of public policy. It's
frankly,
just
also
the right decision.
The science. Yeah.
Period. Listen, guys, I'm not a big Mayor Adams fan. I think he's very, too closely tied to corporate interests in New York, especially real estate developers. But on this issue, he's 100% correct. It's going to be extremely popular, and I think he is going to be a very formidable politician, period. Ross Barkan has been tracking him closely. I would recommend to you his latest piece on Mayor Adams and how he now has this coalition of the business community, labor, and working class African Americans in the city.
Which is like unheard of. Yeah.
And, this sort of very clear direction, I think, is what has been lacking a lot on the Democratic side. Another politician I'm not a big fan of is Governor of Colorado, Jared Polis, who has taken kind of a similar approach of basically like, look, if you're vaccinated, you're good. If you're not vaccinated, that's your own damn fault. And we're moving forward.
Yes.
And he's been very clear about it. And his approval rating in Colorado is way higher than Joe Biden's.
20 points higher.
And again, I'm not a big fan of Jared Polis either, who is also another Democratic corporate tool. But in terms of COVID policy, this very clear and defiant message, I think, is extraordinarily politically smart and potent. And on schools, it's just completely clear to me, based on the data, that it's the right direction. I mean, I understand that in a lot of these districts where they're experiencing, a lot of teachers and staff who have Omicron right now, and it makes it very logistically difficult even to have school because of the number of grown-ups who are sick and out with this thing. But you should be doing everything you possibly can to keep kids in school, because we know they are at very low risk with regards to this disease, negligible risk with regards to this disease. And we know that they were profoundly hurt by virtual school, especially kids who are in the most vulnerable circumstances. So if we can, whatever we need to do to keep the schools open, as a place of stability and as a place of safety and a place where kids get, hot meals every day, we need to make sure that that's a priority. So I think Mayor Adams is completely right
I
here.
couldn't agree with you more. I know some people are worried about child hospitalizations. I did my best to look into the data. The actual total number is really not clear. But from the doctors who are quoted in the Associated Press, more than 2/3 of the kids who end up in hospital have some sort of massive underlying health condition. And I'm not talking about just like being obese. People who are severely immunocompromised, have epilepsy, or have, leukemia or something like that. These are children who are much, much, much more likely to be affected by any, not coronavirus, rhinovirus, flu, any of these types of diseases. I am not minimizing that. I cannot imagine what it is like in order to have a child in the hospital, but it's just important to have context whenever we're talking about population-wide controls and more.
Right. Well, the other reason why kids are a larger proportion of those who are hospitalized at this point in the pandemic is because fewer of them are vaccinated. I mean,
and I
that's
actually
the other
looked into that too in terms of vaccination status and more with children. Yes, vaccination also, in terms of the data, goes and reduces the risk dramatically, again, of hospitalization, but then children have an absolutely low risk in general also.
Yes. And by the way,
no matter what.
I also looked into this,
Yeah.
both for the show, but also because I have kids, one of whom is 4 and is too young to be vaccinated. And what they're saying from the data is that this is not any more of a risk to kids than previous versions, previous strains. So, be at least a little bit comforted by that.
That's right.
Hey guys, thanks so much for watching.
That's right. Just as a reminder, you can become a premium subscriber today. Watch the full show completely uncut, our reactions to each other's monologues. You get to listen to it. You get to ask us questions, all that good stuff. Link is right there in the description or at breakingpoints.com.
Best of all, great way to say screw you to the mainstream media.